Hello, I'm here with Girish Swaminathan from Behaviour Health Service, which is Southern
New South Wales Local Health District.
Okay,
yeah.
Quite an area there. And they've got a new hospital, and Girish has got a poster up in the hall, and it's regarding the emergency department. Tell us about the background.
Yeah, the antibiotics in the emergency department, antibiotics prescribing in emergency department. Because a hospital where we get a lot of locum doctors, a lot of fly-in, fly-out kind of doctors, so they only work a few days in a session, and they move on to work in different hospitals across Australia. So we are looking at the prescribing practices in ED, where we have limited resources like antimicrobial stewardship pharmacists, an infectious disease physician. So we are looking at how our practice is and what factors influence prescribing decisions so that we can influence practice positively in the future.
So you've noticed some bad habits in some of the prescribing, and you're looking to implement some better systems in place. What are the bad habits you've noticed?
Yeah, what we did was we audited the prescription. So we found the choice of antibiotics can predict inappropriate prescribing, and specifically ceftriaxone can predict inappropriate prescribing. Almost 7 out of 10 times when ceftriaxone is prescribed inappropriately. So we asked the doctors about it, and they were really honest about it, and they said, yes, we admit that we use a lot of ceftriaxone when it is not necessary. And a doctor from UK was saying she was shocked how different the practice is compared to UK and how much we overuse here in Australia. And I guess part of the thing was the culture, like these doctors bring the culture with them, the prescribing culture, where they say, this is prescribed like this because I did this while I was an intern, so I continue the same way.
Mm-hmm.
And this is what the physician likes. And when I asked which physician, the physician I worked with a few years back. So they carry this culture around, and that's what we are looking at, trying to change the behaviour, the prescribing behaviour.
So your poster is about how you overcame some of these incorrect prescribing behaviour.
Yeah, the poster is about understanding the prescribing behaviour, or understanding how they make the prescribing decision.
Mm-hmm.
And we also had ward doctors saying before, we don't know why this patient is on ceftriaxone, but it's the ED doctor who started it. So we asked the ED doctors about it. So they were like, we don't have definitive diagnosis, so sometimes we are not clear, so we prescribe this one, but we are expecting the ward doctors to make their opinion and change it.
Right.
So we found a bit of disconnect between ED and ward. Yeah.
Oh, right. So the poster, do you know what number it is?
It's 214.
214.
Yeah.
Okay, so it's right at the back, so start at the end. And it's in a large hall. There's still a few more days of viewing to see all the posters. Thanks for talking with us, Girish.
Yep. Thank you, Jack.
Thank you.